So I'm Sachin Malhotra. I'm CEO for Techcare for All India. We are a health tech company. We are a global health tech startup based out of Belgium. We've got an office in Paris, US, India, Senegal, and Kenya. We're looking to provide health technologies customized to clients and for social impact. There's lots of digital interventions in the patient's journey as well as in a provider's journey. Provider could be the institute or a doctor. So I'll take this on both of those levels. When you're looking at patient interventions, and because we are looking at technologies which can have a larger impact, primarily in countries like us, in India, then we're really looking at something which can impact the 70% or 64% of our population living in rural areas. So there I think primary healthcare is the biggest challenge. So telemedicine is a perfect model in which we can provide quality care access to villages, to remote areas. So that's one. The other side is how can we improve the quality of care that is actually given, which means how do we make sure that the people who are giving quality care are actually well trained. And that I think there's lots of solutions out there, but something which involves a platform which enables the doctors to be trained, the nurses to be trained, both online, offline, plus with all sorts of live video coverages. Imagine sitting in the village and trying to do a CME, which is necessary for any doctor to be doing continuous medical education. How do you make sure that that person is actually getting the right educational tools? In this day and age, technology is the only access to that person, because that doctor is not going to leave the village and come across to the city for a day's training. So digital tools provide the best means for all sorts of access. Lots of personal examples come up here, but I would say technology is always the enabler. It's the people who deliver it that have to deliver it. That's really where the challenge is. If you can get people into the right mindset, technology will really help us deliver the right goods. It's again, at the end of it, technology is only an enabler of all sorts of different efficiencies. Telemedicine is one such example wherein we are working with organizations such as NGOs in Mumbai slum areas, in other slum areas. We are combining the municipal hospitals, the staff utilization at the municipal hospitals to deliver access of quality doctors to the slum areas in places like Mumbai. In really remote locations in the country, in Leh Ladakh and in other such places where there isn't healthcare access at all. Some of these places are remote to the extent that there's no, it's a very small population of people. There's no doctors at all. There might be a midwife or a nurse at the most. So that's where telemedicine and other such technologies are really playing the role.
For more updates from CXOTV, please like and subscribe to our channel.